You're listening to Ask the Expert DSO Edition with Andrew Johnston, brought to you in part by Sonicare, a leader in supporting DSOs and private practices alike. Stay tuned after the episode for a very special message. Welcome everyone into Fast Facts Ask the Expert DSO Edition. I'm your host this week, Andrew Johnston, and welcome into this week's mini episode. The question we're going to be answering today is, how do DSOs differ from private practices regarding treatment plan acceptance? And I feel like this could probably be a much longer conversation, but for the sake of this little mini episode, I'll try and condense it the best that I can. So here's a couple of things to consider. Big picture is, it's not necessarily DSO versus private practice. It really depends on the clinicians. But I will also say that DSOs tend to give clinicians better support, in my opinion. So having worked in the DSO type setting for most of my career, I've noticed that there's systems that are put into place that lend for a higher chance that we'll have higher treatment plan acceptance. And this includes restorative, perio treatment plans. It doesn't really matter what kind of treatment plan it is. Kind of across the board, the ability for them to be accepted is higher. And to probably illustrate this point just a little bit, I want to talk about a very specific position. There's a position that many of the elite DSOs employ, and that is the position of a treatment plan coordinator. So their role is to support the clinical staff. They take the diagnosis and then they take the treatment and they put it together and they present it to the patient. Maybe they'll be using, big screen TVs and models and things like that in a private setting. And they do a lot more patient explaining than sometimes we have time for in the back. And then they go over all the sequence of appointments that it'll take to get those ones completed and try and optimize time. They listen to the patient and they have a lot more back and forth than we can normally have from our chair. And I have seen this in private practice as well. And again, this is like an elite private practice, but it's not generally employed in the private practice setting. When it is employed, it's almost always successful. But the private practice definitely has to have, and so does the DSO, enough patient volume to warrant the position, to be able to pay for that person to do that job. So to clarify one more little point, a treatment plan coordinator should not be doing the job of the clinician. It is still our job to explain the assessments and the findings. We need to prepare the patient for the conversation with the doctors, and also to help explain what the doctor says to the patient after the doctor leaves the room. You know how that always happens. So none of that's going to change. But if you're running behind or the patient needs more attention than you can give in that moment, a treatment plan coordinator is absolutely amazing. So outside of the treatment plan coordinator, DSOs have systems in place usually to help you with verbiage so that you're consistent and that you don't forget things. There's a way to say things in a certain order. There's also expected walkout codes that are associated with different procedures and diagnostics. And there's a protocol for using them that is usually illustrated in some sort of a handbook or something like that. Sometimes in private practice, it's easier to be hands-off with the business side, but on the DSO side, you'll likely have a better understanding of how you play a bigger role within the practice. And so through sheer education, you'll have a better and higher treatment plan acceptance. I hope that helps just a little bit. If you have any questions and need any clarifications, I'm just a quick email away, andrew@tele2hygienist.com. Thanks for listening and enjoy your week. Thank you for listening to Ask the Expert with Andrew Johnston. Sonicare supported this episode, and they're here to support you as well. Don't try to reinvent the wheel. I have linked a website in the show notes of this episode that will give you access to all of the patient support materials Sonicare has to offer. Sometimes it's hard to know where to start with our patients. Let them help. Simply click on the episode title, access the show notes, and click on the link courtesy of our friends at Sonicare. Have a great week, everybody.